You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, helping people get out of pain. We're talking about chronic pain today. With us, we have Austin's go-to pain management physician. And he says his goal as an interventional pain management physician is to avoid heavy medications and invasive back surgeries. We're going to cover all areas of pain today, from migraine headaches, neck pain, shoulder pain, especially back pain, sciatica, lower extremity pain, even neuropathy. With us we have Dr. Vivek Mahendru. Dr. Mahendru, welcome to the program.
Thank you, Randy.
Now, first thing, before we get into today's topic, for people that don't know ASCENT Pain Solutions, who's the typical patient?
Our typical patient is anyone that has pain.
Okay.
We see patients all the way from head to toe pain. For example, we have hundreds of patients that we've helped with migraine pain relief. We have patients that come to see us for neck pain. We sometimes do some injections that can alleviate their neck pain. We see patients with disc problems that have chronic back pain. We see patients with diabetic nerve irritation from diabetic neuropathy. We have patients with chronic pelvic pain, abdominal pain. There's not a single pain treatment or disease or syndrome we don't treat.
Okay, interventional pain management. This is your specialty. Give us a working definition. What is it? Because, you know, in researching this topic, knowing you're coming, a lot of people never heard of this.
That's
right. So what is it?
While we do everything from medication management, physical therapy referrals, all the way to interventional pain management and minimally invasive procedures, an interventional pain specialist is a doctor that basically does minor procedures to alleviate the pain. The goal of the procedure is to diagnose the cause of the pain and then treat the cause of the pain, hoping to eliminate the pain completely.
You say you treat pain as an emergency.
That's right. Pain to us is an emergency. Just imagine yourself. If you are having pain and you don't know the cause and it's newly diagnosed, will you not pick up the phone and call your doctor and go see them? Just figure out what's going on? For us, a patient with pain is a patient in an emergency type situation. We want to get them out of their pain. We treat pain very aggressively. Again, the goal is get rid of the pain.
Now let's talk about your training. I know you're Harvard trained in pain management. You teach some of the things we're going to talk about out of the country. You teach other physicians from I guess all over the world. What does it mean to have 3 fellowships in pain management?
I've been privileged to have trained with some of the best doctors in the country, in the world actually. I spent 6 months at a cancer pain fellowship in New York. I then spent almost a year at Harvard Medical School doing a pain management fellowship. Okay. After that, I spent 6 months with Dr. Gabor Rax, a world famous pain management doctor at Texas Tech University. And so I feel that the training that has been imparted upon me has allowed me to be a very progressive, outside the box thinking physician, so I can bring that hope and efficient care to our patients.
Now, have you had people that were scheduled for back surgery, like a lumbar fusion surgery, that were able to cancel that surgery or eliminate it or avoid it altogether?
Absolutely. I have
100? More than 100?
Hundreds, right? We feel that pain management, if it's done effectively, or let me just say this, effective pain management can eliminate the need for surgeries that may not be completely necessary. Because, for example, I remember a patient very clearly. He was actually supposed to undergo an amputation because he was an injured veteran who worked for the US military, and he had a explosive injury to one of his legs, and he was developing and had developed chronic pain. His option was to undergo an amputation. At the hospital bed, one of the nurses or staff told him about us in our pain center. He came to see us. We put in an implantable spinal cord stimulator device, and long story short, he has been completely living a pain-free life since then.
Okay, and they were going to amputate his leg.
They were going to amputate the leg because of his severe chronic pain.
It was just so bad he couldn't deal with it.
He could not handle the pain.
Which leads me to the question about spinal cord stimulation. In regard to back pain or leg pain, how does it work, and what is it?
We put in these wires in the back along the nerves that we are targeting. These nerves are what we need to diagnose as causing the pain.
Okay.
And once these leads or wires are placed along those nerves, they stimulate and overpower the nerves from preventing them from sending abnormal signals to the brain. And
so your brain doesn't feel the pain?
That's right.
Like it interrupts the signal?
It interrupts the signal, something known as the gate theory of pain. We close the gate to the abnormal sensations and we replace it with positive impulses, positive sensations known as paresthesias, and therefore we give the patients the opportunity of having pain relief.
What kind of conditions does this work best for?
We see a lot of conditions that this is very effective for. Some examples include somebody that is having neck and arm pain, somebody that's having back and leg pain, somebody that's having sciatica, a person that's had back surgery and continues to suffer with pain, or a patient that might be considering back surgery as an option.
Okay.
Spinal stimulation can be a very effective tool in eliminating the pain.
So this signal with a wire goes like in place in the back, just so I understand this correctly, and then it interferes with the signal to the brain so you don't feel like you're in pain.
That is correct.
What do you mean you test it out first? You try it first?
Right, the patient does a trial. We put in through a needle under local anesthetic a wire into the affected nerves that we are targeting, and the needle is removed. We then suture the wire to the back, and they go home and they test it out for a week. During this time period, they go to the shopping, they go to the movie, they go to restaurants, they go to do activities of daily living that has been affected by severe or chronic pain. And during this time period, we want them to come back in about a week or so, telling us, okay, was this a home run or not?
That means does it work?
Does it work? Have they been able to reduce their medicine? Have they been able to do their activities of daily living?
Are there people, what do they say? Like on the ones that it really works for, what do they say?
They say don't take it out.
So once you implant it, because you know that it works, you try it out first, do they feel it? I mean, they could go back to regular activities. They don't have to, I mean, they can swim, they can do whatever.
They go back to normal activities. They go back to regular activities. And now technology has so far advanced that devices have become smaller and smaller and smaller.
And so would you say that there's people in Austin or throughout Texas, how many, I know this is just an estimate, but how many people you think are suffering? Because we talked about this in the green room. How many people are suffering in your estimation that don't have to be? People that are in pain, but they're not being exposed to all the new stuff.
Tens of thousands.
Really?
Yes. Pain is poorly understood. There's lack of awareness. But effective pain management can change the life of a patient.
You're big on customer service.
Absolutely.
You wanted to bring that up on the program today. And tell us about that, what that means to you.
We want patients to feel the compassion we have for them. We want to give them hope. We don't want them waiting in our waiting room for long periods of time. We don't want them to be on hold for long periods of time.
You said you don't want them on hold when they call your office.
We want them to reach a live operator.
So they speak to a live person.
They do speak to a live person. For the last 25 years, what I've done is I have gone and seen and visited the best practices across the country. And we have adopted some of the best protocols that are available for the betterment of our patients. Additionally, having been trained at premier institutions like Harvard Medical School, we've also learned a lot from the best skills and care being provided over there, and we've brought them to Austin.
Do you work with chiropractors, physical therapists, acupuncturists, and you get referrals from these type of people? Is that right?
We get referrals from all across the board. We work with chiropractors, physical therapists, acupuncturists, and others. We're a very multidisciplinary type practice. We think that, and we believe that involving other disciplines at the right time, at the right setting, at the right phases can be a big boon for our patients, be very successful.
Okay. Now you say getting out of pain for some people, they get their lives back. Can you elaborate?
Just imagine you and I take for granted going to the movie, going to the restaurant, picking up your grandchildren, or just doing gardening can be painful for a lot of people. We want to give our patients their lives back. We want them to feel just like you and I do.
Okay.
Life pain-free.
Now what about people that have had fusion surgery, back surgery, and now they still have pain? You say spinal cord stimulation is also good for some of these people.
Absolutely. That's probably one of the topmost indicators that we use as spinal stimulation for, is people that have had spine surgery that unfortunately continue to suffer with ongoing chronic pain. Spinal stimulation can effectively override that pain and outsmart the pain.
Now, you try it out first in the office, and then they go home. Have you ever had anybody, I think you told me this, they're in the office, you're putting the temporary lead to see if it's going to work, and they're out of pain right there.
That's right.
That's happened?
Many times patients will tell us how they're feeling, and many times we'll hear, this is wonderful. A lot of times they'll tell us that my pain is reduced or gone before they go home. And that is very heartwarming experience, because now they're smiling, and we look forward to the results of the trial.
Now look, I live on a street, I think I told you this, everybody has back pain, and a couple CEOs, they go, you know, and they think they have access to the best guys in the world. None of them have heard of interventional pain management physician. Is that common? Where people don't know, they don't get to see you? Because you're covered by insurance,
interventional
right?
pain management has become a common specialty in the United States. But the problem is there's lack of awareness of what we do.
Okay.
I don't think we have been able to get the message out to our patients effectively, which is the reason why so many patients continue to suffer with chronic pain.
I'll put you on the spot here.
Okay.
Depending on what you read, about 500,000 spinal fusions are being done to eliminate back pain per year here in the US. How many of those, in your opinion, this is just your opinion, could have been eliminated, avoided? That means a surgery would have been avoided with some of these techniques we're talking about.
Effective pain management could have easily reduced 50%.
That's a lot of people.
That's a lot of people.
And these people, do they always have to combine it with medications? Or are some people that are stubborn, they don't want any medications, just the spinal cord stimulation?
We see both kind of patients.
Okay.
Ultimately, the goal is to reduce and eliminate the need for medication management long term. We want the patients to get their lives back.
All right. Yeah, but what if you're on opioids and it's working? Look, everybody on opioids, none of them want to be on opioids. But if they work for the patient, they want to keep taking them. Have you ever had people that are off of these?
Yes.
And now they're doing this?
Yes. There are some patients that will benefit only with opioids, but there's a lot more that will benefit with the ability to be off of narcotics completely.
Now, sciatica, spinal cord stimulation, and the right candidate eliminates it?
Yes. I've had hundreds of patients benefit with spinal stimulation and elimination of pain that have got intractable sciatica, also known as, in fancy medical language, lumbar radiculopathy.
Do they need a referral from their primary care physician to see you? Or can they just call you directly?
We see patients both ways.
Now, what about people that are seeing their pain management physician? Do you get a lot of people that are switching over? Second opinion?
We see a lot of patients that want to come and see us for a second opinion. We want to think outside the box. We want to think holistically and differently. Our goal is to give our patients every single possible option they can to get their lives back. And we are happy to see them for a second opinion.
So every FDA-approved procedure, all the new stuff, you have right there.
That's right.
In Austin.
That is right.
Would you, I mean, are there better, more advanced pain centers in America? Or you have it all right there?
We have
I know I'm putting you on the spot there, but
we have what we think is best-in-class care for our patients.
So would you stack your centers in Austin up against any of these teaching hospitals or anywhere in the country when it comes to techniques? Are you using all the new stuff is what I'm saying?
Absolutely. We think we are best in class, and our patients are going to benefit with that level of care.
And this is, why do you like the pain patient, by the way? Because I get medical doctors on the show, and behind the scenes they're going, you know, this is a miserable, depressed group of people. But you like them. Why?
It is a remarkable feeling to relieve pain. It is a remarkable feeling to have a patient smile and be able to do basic things in life. I just can't describe it. It's a passion, it's a mission, it's a vision, it's a calling. Giving hope to our patients, eliminating their pain, can't ask for anything better.
So moving on for the sake of time, peripheral nerve stimulation, is it similar to what we've just been talking about? And what are the conditions it treats?
The conditions we treat for peripheral nerve stimulation are patients with chronic headaches, patients with shoulder pain, patients with knee pain, diabetic neuropathy, patients with hand pain, leg pain. Any of the extremities we can treat with peripheral nerve stimulation.
I'm still not getting the peripheral part. Like, how is it different than what we've already talked about with spinal cord stimulation?
With peripheral nerve stimulation, you actually target the nerves of the extremities.
Okay.
For example, you don't put in the lead in the spinal canal or the epidural space in the back. You place it along the peripheral nerves, such as the nerves of the extremity, nerves of the lower extremity, the nerves on the back of the head, the occipital nerve that can cause chronic occipital neuralgia and chronic headaches.
So there are people suffering with migraine headaches, and you are able to go to the nerve and block the signal to the brain.
That is correct.
Well, it seems like everybody would want to do that.
The goal is to outsmart the pain.
But is not everybody a candidate? Like these, I mean, you've helped like what, would you say hundreds of people with migraine headaches that goes away?
That's correct.
And it's called what?
Peripheral nerve stimulation for occipital neuralgia and chronic headaches.
You don't hear a lot about it, or at least I don't. And I have a lot, you know, I feel like I'm in the know sometimes. But you know, you hear migraine headaches are being treated all these different ways. Is this one of the most effective ways?
This can be a very effective way, especially when somebody has intractable pain. Pain that continues to persist despite treatment is called intractable. And we'd like to help those patients that have intractable pain. Give them hope, give them options, give them best-in-class care, and give them state-of-the-art care.
You brought a video of
right.
how this spinal cord stimulation works from one of the manufacturers. What are we looking at?
You're seeing lead being placed in the back, which is then connected to a battery source, and the battery generates paresthesias or positive impulses to override the negative impulses or the chronic pain from being interpreted by the brain. So that is known as spinal stimulation.
And is this one of the, now have you ever suggested this to patients? Are they resistant to this? That means because you're in pain and you're going, and it sounds like surgery, right? Because it's implantable. Do they resist it oftentimes?
Sometimes patients don't want anything implantable. They've already had surgery, for example, and they don't want any more surgery. We like to do the trial. The trial is what really tells us the percentage relief they're going to get and how effective it is. If the trial is a home run, then we can help them eliminate and abate the pain permanently with spinal stimulation.
So the trial, just for people that are just tuning in, they're in the office, you place a little wire lead in their back, some people feel pain relief right there, blocks the signal to the brain, and then they go home for a week or so, see if it works, they come back, and if it works, then you put in a more permanent implantable device. Is that correct? That's how it works?
That's exactly how it works.
And you say you've had people 20 years in this.
I've had patients with long-term success with spinal stimulation.
And is this the same for the shoulder pain, the headaches, and everything else, this peripheral nerve stimulation, same concept? Try it out first?
That is correct. Even with peripheral nerve stimulation, they do a trial, and if the trial is effective, then we move forward with a more permanent technique. And again, when I say permanent technique, it's reversible. If, say, they come back in about 1 or 2 years from now and they say, my pain is gone for some reason, I don't want this device anymore, it's fully explainable.
Now, what about side effects? Like some of these medications you were telling me cause constipation, brain fog,
sedation, drowsiness.
They're lethargic, all of these things. This doesn't do any of that.
Well, actually, it'll make the patient feel less dependent on the medicines. And if the patients are having those side effects, such as from opioid drugs, interventional pain can eliminate the need for those medicines, and therefore the patients probably can be more awake, less groggy, less sedated, less dysphoria, which basically means not feeling well, and be more interactive with the family and yet have effective pain control.
You say it has a big impact on the family.
It
Why?
has a huge impact
on
the family. Chronic pain affects a person from head to toe. For example, sleep deprivation, social interaction, ability to keep a job, ability to find work, interactions with family. You become grouchy, you become depressed, you become sometimes even angry because you're looking for relief. Just imagine if you were not able to sleep for a couple of nights because of severe pain. I think the next morning you would probably not feel very good.
So they're no fun to be around, that's for sure.
It can be.
So when the pain goes away, they're back.
When the pain goes away, you see what will be a happier patient or a happy patient, and the social dynamics will improve at home, as well as I have patients that have gone back to work, and that's what it's all about, giving them their life back, outsmarting the pain, leaving no stone unturned, and doing it in a compassionate setting and providing state-of-the-art care for other patients.
You say your practices that are across Austin, it's like a rocket ship. That's what you said to me on the phone.
I did.
What does that mean to you?
Rocket ship basically means going and providing the best possible care for the patients.
I'm going to rush you a little bit because we have more things. Spinal stenosis, what is it? And you have this new procedure, it's an acronym, MILD, what is it?
Spinal stenosis is narrowing of the spinal canal due to an aging process, and it develops over time, and you see patients, for example, at grocery stores that are hunched over, leaning forward on a shopping cart.
Why do they lean forward?
Because that helps open the space up a little bit. The spinal canal
And they
is
get
narrow.
relief a little bit.
They get relief by doing that.
Okay.
So they also then develop something known as claudication, which is nerve pain down the leg. The more they walk and stand and do activities, they start having...
So I understand this correctly. So spinal stenosis is narrowing of the spinal canal.
That's right.
And then because of that, it affects the nerves, pushes on nerves, pinches
That's right.
nerves.
That's right.
They feel pain. So how does it normally treat it, and how do you treat it as an interventional pain doctor?
Normally it can be treated from both medication management, physical therapy, epidural steroid injections. Patients will end up with surgery sometimes and failure of treatment.
What type of surgery is for spinal stenosis?
Either they have what is known as a decompressive laminectomy, which is back surgery, or they can then sometimes even have fusions after that, or with that. So what we do is we deploy a procedure known as MILD. It stands for MILD, minimally invasive lumbar decompression.
Okay.
And by doing that, it's done using a percutaneous needle through the skin, inserted under X-ray guidance. We remove some of the hardened tissues and open up the spinal canal without a major back surgery. It can take a couple of weeks for patients to get relief, but we've even had patients that tell us within a few days that they're starting to feel better.
Well, logically, this makes sense. If you just could go in the spinal canal and kind of clean it out a little bit to make more room so the nerves aren't pinched or shoved or whatever, why does everybody do it this way? Is this more of an interventional technique, this MILD procedure?
This is a technique done by interventional pain management doctors.
Okay.
And it is a very effective technique. Just imagine the nerves are sitting in a straw. The straw is flattened. The flattened straw is pressing on the nerves. When we go in with a MILD procedure, we're opening up the straw and making it circular again and give the nerves more room. That's what the MILD procedure does. It gives more room to the nerves of the back so they don't feel pinched anymore. And when they get the relief that they need, they're back to doing their normal activities. They're no longer slouching forward on the shopping cart at the grocery store. They're standing erect. They're walking, they're doing gardening, they're doing activities of daily living.
So people with stenosis, spinal stenosis, do they feel more comfort when they're sitting down and leaning forward?
They do feel comfort when they're sitting down. They do feel comfort when they're leaning forward. They don't usually like to stand or walk.
That hurts.
That hurts because it puts pressure on the
nerves. So
nerves.
They can't go to like an amusement park with the grandkids or whatever, because standing is difficult.
Standing is difficult. Now, even if they do go, you'll frequently see them sitting down and taking a break, because the longer they stand and they walk, the more pain they start having.
It's called the MILD procedure.
The MILD procedure.
You do a lot of these?
We do a lot of these.
Have you had also surgeries, people that were scheduled for surgeries and they were able to avoid back surgery with this procedure?
That is
like
right.
A fusion.
This is an early intervention prior to any back surgery.
Now we're short on time, but I got to ask you about herniated disc. What are you doing? What are some of the newer procedures to treat this problem?
One of the newer procedures to treat herniated discs, first of all, let me explain this. A herniated disc is where a disc bulges and it puts pressure on the nerve, and it can cause not only back pain but also pain down the legs. A disc fix procedure basically is where we insert a scope into the disc. We can see the herniated disc. We then put in a forceps, debulk or remove the disc material, and then at the end we put in the endoscope again to verify that the disc is debulked or removed, the herniated disc, and within a few weeks the patient should be able to start getting relief. It is an alternative to spine surgery and discectomies. So this is a minimally invasive outpatient procedure. They don't require general anesthetic. They walk in for the procedure, they walk back home. There's no large incisions. It's a minimally invasive procedure.
So this disc that's bulging, pushing on a nerve, you're going inside of it, kind of hollowing it out a little bit, putting some medicine, what would you say, radio frequency, cleaning it up, it shrinks, doesn't push on the nerve, and they don't feel pain.
That is
kind of how it works?
That's correct.
So logically this makes sense. The part I'm not understanding is, why doesn't everybody try this as a first-line therapy rather than the surgery or heavy narcotics or whatever?
Again, lack of awareness. Lack of awareness of effective pain management, state-of-the-art techniques.
As you're telling me this, logically, for a herniated disc, this makes sense, right? why isn't this, I guess, accepted here in the U.S. as first-line therapy? You know, before physical therapy, chiropractic, things like that.
I think a lack of awareness. We have some of the best surgeons in Austin, but I think it's lack of awareness on effective pain management and some of these state-of-the-art tools that are out there.
And what's the downtime like? You say that they could walk home and back to activities, how soon?
Within a few weeks.
And then the disc kind of just, it's like regenerating the disc in a way.
The disc actually shrinks by removing the disc that's herniated. That herniation portion becomes smaller and it doesn't make contact with the nerve, and so therefore they're not getting that funny bone sensation all the time down the legs.
We had a conversation on the phone, and I asked a little bit about your approach and philosophy, and we're like a minute left. What'd you say?
I would say whether we stimulate, whether we ablate, our goal is to mitigate, abate, and eliminate the pain.
So is your goal to kind of eliminate pain in all of Austin?
While that may be the goal, I will tell you a lot of patients are suffering. Our goal is to help as many people as possible.
Now, we haven't talked about medications at all, but are there people on addicting medications that maybe can be removed with less addicting medications?
Yes, there are medications out there that are less habit forming, they cause less dependency, and we would like to do whatever we can to help patients be on less habit forming drugs if possible.
Final message, somebody watching this, maybe they had a fusion surgery, but they still have pain, or they have never seen an interventional pain management physician, and it's news to them, some of these techniques. What do you say to them? And maybe they're skeptical.
I invite them in to come see us.
Okay.
As a physician, my goal is to give them hope and heal them. That's what I do.
And every day you see reversals, people that are out of pain that were in pain?
Every day.
Okay,
it's a great feeling. It's a great feeling for the patients, very heartwarming for our staff and I.
Now I'm going to put you on the spot, but I'm going to share something. I think your secret goal is to be the center in all of Austin.
That
and
is
you
our
say
goal.
that's going to happen.
We want to be best in class for our patients.
Dr. Mahendru, I want to thank you for coming on the show. Good stuff.
Thank you for having me.
Thank you. Thank you. Did they go to your website to make the appointment, or they just call directly? Either way?
Both ways.
Okay, good. Thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.